speaker is Carla Colagrossi, and she's from Royal Rehab and LifeWorks at Petersham. And Carla is an accredited exercise physiologist. And she completed her Bachelor of Exercise Sports Science at the Australian Catholic University in 2014, and then she went on to complete a Masters of Clinical Exercise Physiology, also at ACU in 2018. Over the past several years, Carla has been working as an exercise physiologist within the Royal Rehab Group. This has now led Carla to a senior role position at Royal Rehab LifeWorks Petersham. So I'd like to invite Carla to the microphone to present her presentation this afternoon. Thank you, Carla.
Thank you, Michelle, and hello everyone. Again, welcome to today's conference. I just wanted to take this opportunity to acknowledge and thank you all for your attendance, and to the New South Wales Stroke Recovery Association for inviting me to speak and provide some education about fitness and falls prevention after stroke. So, as an exercise physiologist working in predominantly a rehab setting, I've seen firsthand how transformative knowledge and the right education can be in the lives of stroke survivors. Fitness and falls prevention post-stroke is a subject that is both professionally and personally important to me, as I believe that everyone deserves the opportunity to live a fulfilling and active life after stroke. So I hope this presentation can offer you with some support and empowerment to use exercise to regain strength, confidence, and independence in your everyday lives. Whoops. Okay, before we get into it, I just wanted to touch base on some of the topics in this presentation. So I will be discussing the physical and emotional effects of stroke. I acknowledge that strokes do affect people in so many other different ways as well, but we're just going to touch on these specifically and how they can affect an individual's ability to walk, balance, and perform daily activities. The next point is the importance of physical fitness involving physical activity and exercise in not only stroke recovery, but also reducing the risk of injuries and other health conditions, and of course how fitness can contribute to both physical and emotional well-being. And then lastly, we'll also discuss some effective methods for preventing falls in the future. Okay, I wanted to start off by sharing some important statistics that will hopefully shed some light on the significance of addressing fitness and falls prevention post-stroke. Firstly, stroke is a leading cause of neurological disability in older adults. This means that stroke not only affects the immediate health of individuals, but also has long-lasting impacts on their ability to function independently. Next, I want you to consider the lifetime risk of stroke. So by the age of 55, the likelihood of experiencing a stroke is 1 in 5 women and 1 in 6 men. So this demonstrates the high prevalence of stroke and the importance of how we can all take proactive measures in both prevention and recovery. Finally, I think it's crucial for this topic to address the risk of falls amongst stroke survivors. As you can see here, that the statistic is over 70% of stroke survivors will experience a fall within the first 6 months after being discharged from hospital. Can we maybe just have a raise of hands, just because I'm curious to see, has anyone actually experienced a fall here after their stroke? Okay, a few hands there. So this high rate of falls indicates the pressing need for targeted interventions to improve someone's balance, strength, and also provide overall education on safety, particularly during the stroke recovery process. So again, these statistics emphasise... what's happening here? These statistics emphasise a critical need for effective strategies involving fitness and falls prevention education after stroke. And by addressing these areas, we can help to reduce disability, prevent further falls from occurring and injuries, and enhance the quality of life in stroke survivors. So let's look at how a stroke impacts mobility, which affects both the physical and emotional aspects of a person's life. A stroke often results in impaired motor function, where an individual can experience muscle weakness, stiffness or paralysis in their affected limb or limbs, and this can hinder a person's ability to produce quality movements. There's also altered sensations such as numbness, tingling, or sensitivity to temperature, and this can make it difficult to detect or respond to physical cues. And then problems with vision, including partial loss, blurred vision, or even doubled vision. This can further complicate daily functioning, like going out in public or to unfamiliar places and navigating around obstacles. Another very common one is chronic or persistent fatigue. It can make physical activity and exercise more challenging to participate in, and also chronic pain can also be a very common concern. So this impacts your ability to do daily activities. The impact of stroke extends beyond physical impairments, including reduced confidence. So stroke survivors often face reduced confidence in their ability to move and perform tasks, which can affect the willingness to engage in physical activities. Then you also have fear of falling. It's a significant emotional hurdle, especially for those individuals who, like we now know today, have already experienced a fall. This can often lead to increased anxiety and just an overall reluctance to move or try new activities. And lastly, having a better understanding and addressing both the physical and emotional effects of stroke can lead to better support for stroke survivors. And I guess me as a allied health professional, we're able to tailor an effective fitness regime that is specific to what your needs are. Okay, next slide. The importance of fitness after stroke. So exercise and physical activity plays a crucial role in the recovery and well-being of stroke survivors. So we're going to explore the key benefits of just maintaining a regular fitness routine in general. First point is engaging in exercise helps rebuild strength and balance. As we've discussed in the previous slide, these can be left compromised after a stroke, and the improvement in strength and stability is essential for performing functional activities with a better quality of movement and, of course, safety. Regular exercise helps restore and refine coordination and flexibility. This not only helps with movement, but also supports better motor function, making it easier to navigate through different physical tasks that you would face day to day. Exercise is known to elevate physical function, and this can allow stroke survivors to regain independence and improve quality of life. Additionally, a good level of fitness has positive effects on mental health, in reducing the symptoms of anxiety, depression, and enhancing your overall mood. One of the most significant benefits of exercise for stroke survivors, I would say, is its role in falls prevention. So, a consistent fitness routine helps to strengthen your muscles and improve balance, which then in turn will lead to reducing your risk of falls. General fitness can also help manage or delay the progression of other chronic conditions or risk factors that are associated with strokes. So this can include hypertension, which is high blood pressure, diabetes, and other heart diseases. I think this is a really proactive approach to fitness, as it can contribute to better long-term health and well-being for stroke survivors. So just to summarise what I've just spoken about, integrating exercise into your daily life after a stroke is vital for enhancing fitness and physical capabilities, mental health, and safety. I will go on to explain how you can actually commit to a structured fitness program, and participate in regular physical activity after stroke. But first, I think it's a good idea that we actually know the different characteristics between physical activity and exercise, and how you can integrate both in maintaining your health and improving your fitness to prevent falls. So, physical activity encompasses all body movements that result in using up your energy, essentially. I will go through a few examples, but it's often classified as less structured, and can easily be incorporated into your current daily routine. On the other hand, exercise has a specific focus or goal in mind. It's generally planned and structured with the intention of improving or maintaining physical fitness. So, just to go through a few examples now of the different types of physical activity. We've got walking or hiking, cycling, swimming, dancing, which you've all done today, which is great. Yoga, Pilates, and then, of course, your activities of daily living. So this can involve showering, dressing, rolling or getting out of bed, cooking, and going from sitting to standing positions, or vice versa. I've also listed some specific focus areas that can be incorporated into an exercise program or routine. The first being strength training, and it is one of the most vital components in falls prevention because it helps to build and maintain muscle strength, which is important for your balance and stability. Within strength training, the focus should be on major muscle groups. You can use your own body weight or added resistance with equipment such as resistance bands, dumbbells, or loaded gym machines. Next, we have cardiovascular training, and this can also be referred to as aerobic exercise. It's essential in managing the symptoms and risk factors associated with stroke, as well as supporting your heart health to improve circulation, endurance, which can contribute to better balance, stamina, and of course, again, reduce falls risk. Cardiovascular training can be categorised as exercise or physical activity, like I mentioned, that causes the heart rate to increase. It can be performed for long periods of time or short intervals throughout the day. Finally, We also have specific balance exercises or training which can aid in falls prevention by correcting your alignment and posture to improve overall stability. Adequate balance results in a better understanding of the body's positioning and ability to sense its location, movement, and actions. Some examples you can focus on include improving your walking speed, moving around or over obstacles, different surfaces, navigating stairs, slopes, or even participating in Tai Chi. Now, Tai Chi, as physical activity, has been shown by many studies to be beneficial for balance as it involves safe, slow, and controlled movements, which enhances the body's awareness and coordination. Okay, on to actually how to develop a safe exercise program. So creating an effective exercise or fitness program, again, is very important for individuals recovering or living with an impairment after a stroke. A regular exercise routine improves overall fitness to reduce the risk of falls. I've included here just some key recommendations for developing a safe and effective exercise program. So it is recommended that you aim for 150 minutes of moderate or 75 minutes of more intensive physical activity or exercise each week. You can also combine activities to meet your goal, depending on your personal preference, schedule, and even tolerance to exercise as well. For individuals experiencing chronic fatigue or a significant disability post-stroke, it's advised that you participate in shorter, more intense activities, and this approach allows for more frequent sessions without actually feeling overwhelmed to incorporate exercise into your daily routine. Again, we have muscle strengthening activities at a moderate or greater intensity. You want to be doing this at least twice a week, as well as interchangeably your cardiovascular and balance training. Lastly, a key message for everyone is to limit the time spent being sedentary. So remember, all forms of activity counts, whether it's structured exercise or simply just increasing your daily movement. On to the next point. Ensuring safety is paramount when implementing an exercise program, and here are some precautions that you can keep in mind. So you should always start by consulting a health professional before beginning any type of exercise program, whether it's your GP for medical clearance or an allied health therapist to assess and prescribe the exercises for you. Any health provider can personalise their recommendation based on your specific health needs and recovery status after stroke. You also want to begin with low intensity and short durations of exercise and then gradually increase the intensity as you can tolerate it. This helps to prevent injury and overexertion while still allowing for your body to adapt to the new physical demands. Proper use of equipment or demonstrating correct technique is also important when considering safety. You should ensure that when you're doing an exercise or using equipment that you have access to, it's suitable to what your fitness levels are. And again, working with a therapist, they can provide you with some useful tips on the correct ways of doing exercises. Create a safe environment to exercise in to minimise the risk of falls or injuries. This can include having supervision or exercising with a friend, family member, carer, or again in a therapy session. as well as removing any hazards that may cause future accidents. So by following these guidelines, you can ensure that your exercise program is both safe and effective in supporting your overall health, but of course, again, in preventing falls. Okay, I've included also a few falls prevention strategies. Some of you might be doing these already, but it's also good to consider these in your everyday life as well, and where you can implement it in your exercise routine. So the first point is home modifications. These might be necessary to create just a general safer living space for yourself. This includes removing trip hazards from walkways or spaces such as rugs, cords, just general clutter. You can also install grab rails in key areas like near steps or the bathroom. When exercising, you can make sure that you have something sturdy to hold on to, and that way it will provide you with some extra balance support. Non-slip mats can be placed over slippery surfaces to provide additional stability. Adequate lighting is also essential for preventing falls at home and when exercising. So you want to make sure that any rooms or walkways that you're using are well lit. And particularly if you're getting up during the night, you have maybe night lights to illuminate your space. You can also utilise assistive devices or mobility aids such as a walker or cane if it's recommended by a health professional. These devices again provide extra support when moving around, and you can also ensure that your exercise equipment is being used correctly. There are some specific devices that can be incorporated to help with your function, particularly when you're exercising. So some examples that come to mind are hiking poles, adaptive or possibly wheelchair accessible machines. We also have body weight support systems if you're doing any treadmill training or walking. And then there's also straps and gloves to allow for better grip if you do have hemiplegia. We have some other strategies as well just to ensure overall safety, and these include, of course, maintaining a healthy, balanced diet. This supports your overall health, in particular muscle recovery, bone density, and cognitive function. Getting your eyes regularly checked. It can be important for your vision and any changes to your vision, as poor vision does put you at a higher risk of falling if not corrected. Wearing appropriate footwear that fits well. You want it to be supportive and not prone to slipping. And then lastly, reviewing your medications, generally with a healthcare provider, so that you can better understand any potential risks or side effects that may affect your fatigue, blood pressure, balance or coordination. And overall, implementing these falls prevention strategies can enhance your safety and help in maintaining independence. Okay, if you would like some more information from some of the topics that we spoke about in this presentation so far, I've included a few resources that you can use as a reference, in particular that help with exercise guidelines and falls prevention. So I've included the Stroke Recovery Association and Stroke Foundation websites. I think that they're a great tool to be informed about the evidence-based practices for stroke recovery and prevention, as well as just creating a supportive community for stroke survivors, which is very important. One that I use quite frequently as well as an exercise physiologist is the Exercise Right website, and this was created by Exercise and Sports Science Australia. It's designed to provide fact sheets about living with chronic conditions and includes very specific free exercise programs as well that are actually all prescribed by health professionals. And finally, more specific to falls prevention, there's a lot of useful information from the New South Wales Health booklet titled Staying Active and On Your Feet. Some of you may have heard of that already. It can be accessed online and it's also available in different languages, which is very helpful. And it really does go in depth about how to live an active lifestyle that is safe and prevents falls. So on that note, I guess we'll take the time now. If you've got any questions or comments, please feel free to ask.
Has anybody got any questions? Any questions at all? I'm just wondering if you could tell us the difference in terms of strengthening exercises, why they're so important in terms of balance.
Well, as I've mentioned during this presentation, strength training is probably one of the most vital components to your exercise and fitness regime. There's a lot of evidence out there supporting it. And in terms of stroke recovery as well, as we know with repetitions and doing specific strength exercises, that can help with neuroplasticity, which I guess in short helps rewire the brain and make those connections again so that you're able to produce movements like you were before. Yes?
How soon after a stroke can you start to work on your body with exercise?
Yeah, I
How
think
soon?
that's a great question. I think, again, it comes down to speaking with your healthcare provider or whether you're in hospital, the team that you're working with, they would be able to give you the clearance of when it's safe to start exercising. From my experience, working in rehab, we want to get people moving quite early on after their stroke, because the more movement you're doing, the better it is for your overall health and recovery.
Approximately how long is that, do you think?
Oh, it's a tough one to answer because I think everyone's so affected in different ways from stroke. So it's really dependent on the severity and what your health status is at that moment in time.
How many of you would be doing some form of exercise every week? Okay, that's good. And how many are doing that under the care of a sort of an exercise physiologist or a physiotherapist? Oh, that's quite a few of you. And for those of you who aren't, how are you going about doing your exercise? Is it through just walking, or have you got a tailored exercise program? Anybody willing to share?
Walking,
Walking?
riding a bike,
Riding a bike?
skipping,
Skipping? Ah, excellent.
and if you call it that, and
Good for falls. Okay.
some push-ups and things like that.
Okay. Excellent.
Helped a lot, but
Alrighty. Yep. Tom, you said you put your hand up. What are you up to, love?
12 months after the stroke, I started going to the physio at Gorrigan, and I went there for 1.5 hours, 5 days a week. Yeah, for 5 years. And also went to swimming 1.5 hours a day for 2 days a week, right? And then I went to the what do they call the place? Just the Lake Haven.
Recreation club.
Went to the recreation club at Gorrigan, where I also was there for 1.5 hours, 2 days a week, and all those things I did for 5 years. And I reckon that's the secret to being healthy. Well, not that I'm healthy, but that's the secret, in my opinion. You have to have a regular basis of exercise, and now I still go to physio now, but I only go once a week. See? And exercise, I do exercise myself. My exercise is different to other people's, so you only have to have about 10 minutes a day, but I do it every day. See, 7 days a week.
And one of the things I think one of the ladies on the panel mentioned was a dog. And I have to say, it's my dog that gets me out of bed every morning to make me walk. And he's a big dog, so he walks fast, so therefore I have to walk fast. So often an animal will push you along where you wouldn't, I wouldn't be up at 6 o'clock any other day unless I had a dog to walk. So those sort of things are something else you can consider as well. Anybody else want to share what they're doing? Sorry, there's somebody down here. Colin?
I spend an hour in the gym once a week with an exercise physiologist, which is fine. It's a normal gym, Anytime Fitness. And I've got a home exercise bike, a modified semi-recumbent, which I do a couple hours a week on. And I put on truckloads of weight after the stroke. Like 20 kilos. And I'm back to close to pre-stroke weight.
Oh, great.
Which I don't understand how.
That's excellent. That is excellent. Because I think that's a really important benefit of exercise, is actually losing weight. And as Carla pointed out, there's other health conditions associated with being overweight as well. And particularly diabetes, which is very closely associated with stroke. So again, in terms of secondary stroke prevention, it's a great way to go. Exercise.
Yeah, absolutely.